Hi students, this is Dr. Ways and welcome to your lecture on the vertebral column. So on our trip through the body, we have made our way to the back. So we're going to begin the back, starting with talking about the vertebral column. And to start that off, we have to go back to the early embryo. And in the early embryo, we had this concave structure along the back where everything was curled. You know how they talk about fetal position. Everything was curled in this fetal position. And that was called the concave primary curvature of the back. But as we were born and we began to walk and be around gravity, we had to develop our spine, our vertebral column developed other curvatures. And so we call these now either primary curvatures or secondary curvatures. All right, and the primary curvature is a curvature that is consistent with the concave primary curvature that was in the early embryo. Secondary curvatures are those that occurred as a result of gravity and doing things within the realm of gravity. So our two primary curvatures in the adult skeleton are the thoracic curvature right here, and notice that that follows the same pattern as the embryonic primary curvature of the back. And then the second primary curvature is the sacrococcygeal curvature. Notice it's still concave in relation to what the original curvature of the back was. Our secondary curvatures, first at the cervical curvature, develops around 3 to 9 months when babies start picking up their heads and crawling. And then the second secondary curvature is at our lumbar region right here that develops around 12 to 18 months after birth when walking starts to happen. And so we have this secondary curvature cervical, primary curvature thoracic, secondary curvature lumbar, and primary curvature sacrococcygeal as a way to balance our body's weight on a vertebral column that expends the least amount of muscular energy to maintain an upright position in a biped, such as humans. And if you look at the line of gravity, it is between the curvatures. So the cervical curvatures anterior to the line of gravity, the thoracic curvatures posterior to the line of gravity, lumbar anterior, and sacrococcygeal posterior. So it's evenly distributed, or at least fairly evenly distributed. All right, so we have vertebrae that make up our vertebral column, and we have 7 cervical vertebrae, which we denote C1 through C7. We have 12 thoracic vertebrae, which should make sense to you because we have 12 ribs, one for each thoracic vertebrae, and that's T1 through T12. 5 lumbar vertebrae here in pink, and that's L1 through L5. You notice they use Roman numerals here as well, so be familiar with both ways of looking at numbering them. We have the sacrum, which is one bone, but it is five fused sacral vertebrae. And while that's not important for the bones themselves, it will become important when we talk about the spinal nerves that are associated with them. And then the coccyx, which is right here, also known as our tailbone, and that's 3 to 4 fused coccygeal vertebrae, 1 through 4. All right, so you should be familiar with the general anatomy of a vertebrae, and so all the different parts in gray are the ones that you need to know. A couple things to point out: if we're looking at individual vertebrae, some things are going to be different than when we're looking at the vertebrae all put together. For example, this inferior vertebral notch right here, when it's stacked on another vertebrae, it becomes the intervertebral foramen, because instead of a notch, it's now going to be a hole because it has something underneath it. And each vertebrae is stacked on each other not directly bone to bone, but the bodies are stacked on this intervertebral discs. All right, and the body of the vertebrae always faces anteriorly, and the spine of the vertebrae always faces posteriorly. So keep that in mind. If you're looking at the spine of the vertebrae, you're looking at the back of the person, and that makes sense because if you look at the spine of somebody with their shirt off, or if the back of somebody with their shirt off, you notice that there are little bumps all the way down the spine, all the way down the back in the middle, and that's from these spinous processes sticking out. All right, now each type of vertebrae has a slightly different morphology to it. So we'll start with the cervical vertebrae, and what you should note about the cervical vertebrae is, first of all, they have a smaller body. They have a bifid spinous process, as well as a bifid transverse process. And between the transverse processes, you have a transverse foramen through which blood vessels are going to flow. More specifically, in the first 6 vertebrae, through the transverse foramen, you'll find both the vertebral artery and the vertebral vein, but in the 7th vertebrae, cervical vertebrae, you will only find the vertebral vein. So that means that the vertebral artery is on the outside of cervical vertebrae number 7. Specifically, C1 and C2, cervical vertebrae 1 and cervical vertebrae 2, have the most different morphology of any of the vertebrae, and that morphology is related to its function. So C1 is also known as the atlas, and it's known as the atlas because, well, first of all, you don't see a spinous process, you see a tubercle instead, a little bump. And you don't necessarily have a body to it, but on these facets on either side are where the occipital condyle of the skull sit, and so it's named Atlas because the Greek god Atlas held up the world. So this particular vertebrae holds up the skull, which is how it got its name. All right, if we pile the atlas on top of C2, which is also known as the axis, we see that there's this structure called the dens that's on the anterior surface that lies here in the anterior portion of the atlas as it's sitting on top of the axis. All right, and it has this transverse ligament of the atlas through it. And so going back to function, if the atlas is holding up the skull on the occipital condyles, the atlas allows our head to nod back and forth like we're saying yes. But the atlas's relation to the axis is such that it pivots around this dens. And so what the axis allows our head to do is the head plus the atlas will pivot, allowing us to rotate our head back and forth like shaking our head no. And the axis, C2, is the first vertebrae where we're actually start seeing a spinous process. One other special feature of the cervical vertebrae is that C7 has a spinous process that sticks out farther than any of the other cervical vertebrae, and we call that the vertebrae prominence. So if you go to your back and feel down your back to the first vertebrae spinous process that you feel, that's going to be C7, the vertebral prominence of C7. Right, so that very first spinous process that you're able to feel on your back. So I recommend, feeling that on yourself. Look at your lab partner, look at your significant other at home, and point out where that vertebral prominence is, so you get a good idea of where you are within the vertebral column. The thoracic vertebrae are pretty standard. In fact, the thoracic vertebrae are typically what we use for demonstration purposes when we're trying to look at the general overview of the parts of a vertebrae. So specific to the thoracic, though, is that they are going to have spots for articulations with the ribs. And so these are these demi-facets, demi referring to half or partial facets that the ribs articulate onto. And remember, the ribs are going to, the head of the ribs is going to attach here. It's going to curve back around towards the back and then anteriorly. All right, not that acute of an angle, but you get the point. And here's a picture kind of showing that. What you need to realize is that the head of the vertebrae, the head of the rib has a superior portion and an inferior portion. The superior portion attaches to the inferior demifacet of the thoracic vertebrae, and the inferior portion of the head of the rib attaches to the superior demifacet of the vertebrae underneath it. Okay, and as the rib is heading outward from the head, you got the neck, and then you have the tubercle. The tubercle makes a joint with the transverse process of the vertebrae, and that's called a Costo transverse joint. All right, and the way that they're numbered, T1 is different than all of the other thoracic vertebrae in that it has a full facet for rib 1. So rib 1 is associated with vertebrae 1, and it has a demifacet for the superior part of rib 2 attachment. So the way they're numbered is T1 is associated with rib 1. Between T1 and T2 is where we'll have rib 2. Between T2 and T3 is where we'll have rib 3. All right, so the rib is, the number of the rib is above the vertebrae that it's associated with, all except for T1. Lumbar vertebrae are different in that they are much bigger, especially the body, because they are carrying the most weight. And the other thing you'll find is that the spinous process of the vertebrae are much more blunted and flat than what you will see with the thoracic vertebrae. One thing I forgot to mention is that all the vertebrae, we said the spinous processes are in the back, but the spinous processes are always pointing in a posterior fashion. So if you're sitting there and you're trying to put together a vertebral column from a set of bones that are disarticulated, always make sure that the vertebrae, the spinous process of the vertebrae, is pointed downward. All right, that's the correct orientation. All right, the body of vertebrae, lumbar vertebrae 5, makes an articulation with the sacral promontory here, and then the sacrum is one bone, one large bone that's a mixture of 5 fused vertebrae, as we said before. So be familiar with the names of the different parts: the ala, which means wing, the anterior sacral foramina, which on the posterior side they call the posterior sacral foramina, and then we have the posterior crest of the sacrum with tubercles on it. So that's always going to be pointed posteriorly, kind of like the spinous processes of the rest of the vertebrae. And then at the superior end we have the sacral canal, and at the inferior end we have the sacral hiatus, through which spinal nerves are going to pass. All right, then at the inferior end we have the coccyx, which again is made up of several fused vertebrae as well. And this is going to have that primary concave curvature. Between each one of the vertebrae you have these intervertebral discs, and if you look at the intervertebral discs, they have a very specific structure to them, consisting of the annulus fibrosus, which are layers of concentric rings, mostly made up of collagen, mostly made up of collagen and fibrocartilage. And then in the center, we have this structure called the nucleus pulposus, which is a gelatinous type structure that is designed to absorb shock. And over on the right, you see the cervical vertebrae, thoracic, lumbar vertebrae, and how the intervertebral discs vary between each one of these depending on how the bodies of each vertebrae are arranged with each other and the type of vertebrae. Notice that the lumbar are much larger than the thoracic, which are larger than the cervical. All the vertebrae articulate with each other by the inferior articulating processes forming a joint with the superior articulating processes of the vertebrae just underneath it. But they're held together by various ligaments, and so these ligaments are what we want to talk about now. And the first one is the Ligamenta Flava, or if we were talking about a singular one, it would be the Ligamentum Flavum. Notice that they are attached to the superior lamina of the vertebrae anteriorly, and then to the posterior laminae of the vertebrae inferiorly. So the anterior superior vertebrae is attached to the posterior inferior vertebrae lamina of the vertebrae above it. All right, Ligamenta flava is also known as the yellow ligament because this is one of the few ligaments that contains a lot of elastic fiber, so there is a lot of stretchability within these particular ligaments, which makes sense if you want there to be some flexibility within the vertebral column. And so here you see a better picture of the superior anterior lamina of this vertebrae connected to the inferior posterior lamina of the vertebrae above it by the ligamentum flavum. Next we have the anterior longitudinal ligament, which is a long, broad ligament on the anterior border of the body of the vertebral column, running superiorly all the way to inferiorly, from the occipital bone actually down to the sacrum. And it's not just like somebody slapped a piece of tape to the front of to the anterior portion of these vertebrae. It's actually fused within the bone itself. So this ligament is physically attached to each vertebrae. And then we have the posterior longitudinal ligament. And notice that the posterior longitudinal ligament runs along the posterior portion of the body of each vertebrae, again connected to each one of the vertebrae. Between the body of the vertebrae and the layers of the dura of the spinal cord, the protective layers of the spinal cord. These two, the posterior and anterior longitudinal ligaments, are not as stretchy, don't have as many elastic fibers as the Ligamenta flava. So their job is to, if you're talking the anterior, to resist extension. So if you bend your back backwards, it kind of, this is responsible for resisting that extension. And then the posterior longitudinal ligament, when you're bending forward, resists flexion. All right, so these only allow you to bend your vertebral column so far so that you don't put pressure on the spinal cord. The next type of ligament is the interspinous ligament. Remember, inter means in between. So you're going to find this ligament, it looks like sewn in fibers of collagen between each spinous process of each vertebrae. And there is going to be a rope-like ligament called the supraspinous ligament that's attached to all of the interspinous ligament that runs from the external occipital protuberance up here in the skull all the way down to the end of the sacrum. When these interspinous ligaments reach the cervical vertebrae above CV7, Notice that they spread out beyond the spinous process of the vertebrae, and those there are called the ligamentum nuchae. And if you bend your head forward and feel the line in the back of your neck that forms, that is the ligamentum nuchae that you are feeling, that forms that ridge in the back of your neck when your head is flexed in a forward direction. And again, ligaments are designed to hold bones together, so these ligaments all help support the spine to maintain the position that it's supposed to be in. In other words, that neutral position.